Full Knee Replacement and Rehabilitation by Abby Perry and Katie Hash.
Our topic is a full knee replacement and the rehabilitation that follows. A full knee replacement involves modification of a damaged knee joint by replacing it with artificial components. After surgery and rehabilitation, the patient will experience less pain and have a better quality of life.
In our case study, Christy, a 45-year-old female, has been an athlete all her life. As much as she loves to be active, it has taken a toll on her body. She struggles with chronic and debilitating right knee pain and an impaired gait limp for 20 years. She injured her knee playing sports as a young adult, and because of the lack of technology at the time, she decided to let her knee heal on its own. Christy now has crunchy knees because of bone-on-bone contact from the lack of cartilage. She also has painful arthritis in her right leg that makes day-to-day life almost unbearable. Risk factors include intrinsic and extrinsic. The intrinsic includes biomedical patterns. Example of this is valgus collapse. Another is kinematic factors, and this is increased hip flexion, landing flat-footed, having less plantar flexion, decreases in core trunk control, and less knee flexion. And all these kinematic factors are more common in women than in men. And then for extrinsic factors, this includes playing sports, mostly contact sports like basketball or football. Another thing is hits or pressure to the knee, valgus and varus forces, falls or accidental injuries, and unforeseen trauma or car accidents. In the case study, Christy played sports, which increased her risk of knee injury and fueled future joint pain.
When knee pain and stiffness make daily living a challenge and interfere with normal activities, it may be time to seek medical opinion from a primary care doctor. The doctor may first encourage the patient to try over-the-counter pain medications, using a cane, or going to physical therapy. When these methods fail to properly alleviate the patient's pain, it may be time to seek out surgical methods of treatment. The primary care doctor will refer the patient to an orthopedic surgeon who will determine the best course to take in order to relieve the pain. First, the doctor will ask questions to get background information on the variety of symptoms the patient is feeling. Then, a physical examination of the knee will take place so that the surgeon can look for swelling or abnormalities. The surgeon will also examine x-rays of the knee to see the internal structure and potential causes of pain. Lastly, the surgeon may have the patient participate in range of motion exercises as well as strength tests to gauge the current functioning of the knee joint. In the case study, when Christy decided to visit her primary care doctor about her discomfort, she was encouraged to seek out an opinion from an orthopedic surgeon. At her appointment, she had x-rays taken of her knee, a physical examination, and she told the doctor about her symptoms. During the total knee replacement surgery, the surgeon makes an incision 8 to 12 inches in length on the anterior portion of the knee. The muscles and tendons are separated to the side of the joint for better visualization during the procedure. Then, the surgeon cuts the distal end of the femur and fits it to the new titanium femoral component. The head of the tibia is hollowed out so that the titanium tibial plate component can be inserted. The posterior surface of the patella is replaced with the plastic patellar implant, and the lateral and medial menisci are exchanged with plastic spacers to allow the artificial knee joint to glide with movement. The anterior and posterior cruciate ligaments are removed during the total knee replacement because their origin and insertion points are replaced by the titanium components. A locking mechanism is inserted into the artificial joint to prevent the hyperextension of the knee. Before closing the incision, the surgeon will bend and rotate the new knee joint to make sure it is functioning properly. After the surgery, the patient may feel discomfort related to the muscles and ligaments adapting to the new joint. The pain should subside as the knee is strengthened. The joint may also make a clicking noise, but that is completely normal and is due to the articulation of the implant. In the case study, Christy was told that a total knee replacement would be her best option to heal her joint pain. A few weeks after visiting the surgeon, she underwent surgery. procedure was successful and the surgeon was pleased with the range of motion the artificial joint allowed for. After the surgery, Christy had some discomfort, but that subsided after she took pain relievers and walked around on her new knee.
Rehabilitation can include a personalized plan for each individual patient. These plans are tailored to the patient's ability, and we do not want the patient to be pushed past their potential, but also the patient needs to be pushed hard enough so that they can make a full recovery, and movement is very important to do so. Another rehabilitation method is physical therapy exercises. Patients need to do these exercises as to strengthen their leg, restore knee movement, help them walk on the new knee, and examples of these would be knee straightening and bending exercises, as shown in the picture on the right. Another rehabilitation method is nutrition. The food that the patient eats before and after the surgery is very important, and specific foods include high protein foods to get the muscle back and build healthy tissue, foods with iron that will help make the patient's energy come back, and then vitamin C filled foods that repair damaged tissues, keep the bones strong, and helps the body absorb the iron. An additional rehabilitation method is educational intervention and giving the patient expectations of care. So to educate the patients on how to make a full recovery and make the recovery as easy and smooth as possible, and making sure that the patient is aware of their bearing status. In the case study, Christy was told to put weight on her knee very soon after her surgery to improve her ability to make a full recovery as soon as possible. She was also given many at-home exercises that would allow her to continue her care by herself at her own pace. Additionally, her healthcare provider also stressed the importance of a balanced diet full of the nutrients she would need to get herself back to normal. Prevention measures can include wearing correct protective gear and wearing the correct stable shoes, as well as having sport fields that have less friction, as more friction causes more knee injuries. An example of this is having grass fields over turf fields, as turf fields have more friction. An additional prevention measure is providing athletes with more education and teaching them how to land and decelerate in a more controlled fashion with reduced valgus collapse. Also teaching them of increased knee flexion and improved trunk control, as well as balance and proprioception.
Knee replacement surgery is a great option to treat a knee injury when all non-surgical methods fail, such as medication or using a cane. The condition of the knee is diagnosed and surgery is recommended by the orthopedic surgeon. The procedure involves replacing the damaged knee joint with an artificial joint by modifying bones, ligaments, and articular cartilage.
Rehabilitation is an essential step in the road to recovery and requires patient cooperation. Overall, a general awareness of knee injury prevention is important to keep people safe and free of pain. Our sources are cited in MOA format. The bibliography and objectives are by Katie Hash and Abby Perry. Intro, Diagnosis, Procedure, and Post-Operation is by Katie Hash. Case Study, Risk Factors, Rehabilitation, and Prevention is by Abby Perry.